Okay, our first structure is called the ora serrata, and it is between the retina, which is right here, and the ciliary body, which is right here. So it's going to be right in this area. Next is the conjunctiva, which is the transparent covering. So it's going to be attached to the outer surface of the eye, and except the cornea, of course, and it loops under the eyelid, and it's why you don't lose the contact to the back of your eye whenever it moves off center. It's also where, if you get an infection, you get something called conjunctivitis or pink eye. Next is the canal Schlemm, here, which is this little opening here and here, so both places. And it's where aqueous humor is removed from the eye. So the aqueous humor fills in here, and it gets removed from the eye through here. Okay. Next is the iris, which is right here. So it's the pigmented tissue behind the cornea, so behind here. So it's the pigmented tissue, and it gives the eye its color, and it controls the size of the pupil opening, which is here, so it can adjust the amount of light that is let into the eye. Lens. The lens is the transparent tissue behind the iris, which is right here, and it has the ability to change shape or accommodate. Next is the pupil, which is right in here, which is the door through which light enters the eye, which is strange because I've usually heard the eye referred to as a window, not a door. Next is the cornea, which is the outer clear part of the eye. It protects the eye and works with the lens to adjust light and refract light to focus images on the retina. Next is the aqueous humor, right here. So it's the fluid that fills the anterior chamber, keeping the cornea, the iris, and the lens nourished, and it also maintains interocular pressure. So, okay, and then next is the suspensory ligaments, which are here and of course here on both sides, and they help the lens with accommodation. Next is the ciliary body, which is right here. So it's right here, and it produces aqueous and helps the lens accommodate. Next is the sclera, right here. And so the sclera is the white of the eyes. That's all right here. And it protects the innermost delicate parts, and it does not cover the cornea, and it also gives the eye its shape. Next is the choroid, right here. So it's the layer between the retina and the sclera. So it's this black area right in here. And it provides nourishment to the outer layers of the retina. So next is the retina. And it is the innermost part of the eye. So it's all right in here. All this one with the little dots there. That is the retina. And it contains photoreceptors responsible for developing the picture that gets sent to the brain. It is also the most metabolically active tissue in the entire body. Okay, next is the fovea centralis. The fovea centralis is this little part right here. this little part right here. Now the surrounding part is called the macula, and that's what surrounds the fovea centralis. It's the fovea centralis is the central part of the macula, which is right here, and it has the highest concentration of cones. Next is the macula, which is right here, which, like I said earlier, it surrounds the fovea centralis, and it's the central area of the retina, and it's the area of best vision, and it's used for reading, fine detail, and color. And the fovea centralis has the most acute vision. Okay, optic disc. Is right here. So optic disc is back here. And it's the area where the optic nerve is leaving the eye, and it creates a blind spot. Okay, next is the optic nerve, which is right there. So the optic nerve is composed of millions of fibers that act as a cable, and that's what relays the information of what the eye is looking at, and then it sends it to the occipital lobe of the brain. Okay, and next is the vitreous humor, and it's the clear jelly that composes 2/3 of the volume and weight of the eye. So it's all back here. Okay, that's all for the structures of the eye. Now we're going to talk about some conditions that may happen to the eye. So the first one we're talking about is aniridia. So, and that's a congenital defect of the iris, which is here and here. And it's what happens is either the iris is partially developed, or there's no iris at all, which is as a result, the eye is unable to regulate the amount of light that comes in, so it causes photophobia. Next is the Canal-Schlemm, right here, and what happens when one or both become blocked, the aqueous humor, which gives nourishment to the cornea, iris, and lens, it gets continually made by the ciliary body, and then it gets released through the trabecular meshwork and the Canal-Schlemm. And then when that becomes blocked, it has nowhere to go, so it builds up and builds up and builds up, and then intraocular pressure builds up, and that ends up damaging the optic nerve. And when that happens, a lot of times vision loss occurs. Okay, and next and last is cataracts. So that's what happens when the lens becomes cloudy or hazy, and there's a few ways this can happen. The most common is age. As you get older, it happens, becomes more cloudy and hazy. And so it can be congenital. It can be caused by trauma. Sometimes it's even caused by meds, and that's one of the things that I found while learning about this particular structure of the eye is that one of the meds that I'm taking, allopurinol, can cause cataracts, which is very interesting.